Welcome to summary of the May board meeting. We started the meeting with some really positive news, hearing about the award that's been won by the Symphony programme as the BMJ National Primary Care Team of the Year. Really positive news and affirmation really of the work that Symphony has been doing in South Somerset over the last 3 years. We moved on to hear around the current operational state of the hospital and noted the significant improvement in hospital capacity from middle of April with the closure of all escalation beds. That's now enabled us to move the wards around to start the refurbishment of EAU that's going to be taking place over the next four weeks. The focus is now moving into our winter plan for the coming year, and there'll be more of that in future meetings. YDH has also been chosen as one of 2 trusts nationally to take part in the NHS Employers Diversity and Inclusion Partners programme. And linked to this, we will be welcoming Dr. Vivian Lepar-Sisse, the chair of the NHS BME network, to YDH on the 26th of June. The board received a presentation from Helen Williams, Head of Midwifery, and Sian Jones, one of our project managers, on the action plan that has been underway to implement 10 national priority areas to support improvements in safety within maternity units. And successful implementation results in a reduction in our clinical negligence insurance premium, which we call CNST. And so the board signed off our compliance statement against the 10 standards as a result of the presentation that we heard. We had a presentation from Tom Norton, our Chief Information Officer, around our preparations and the arrangements we have in place for cyber security and also the GDPR requirements. And this happened ahead of the new legislation coming into action on the 25th of May. We then moved on and spent quite a lot of time looking at our performance headlines this month, and some of the key headlines are from a financial perspective. On paper, month 1 we have delivered our plan, and this is despite this plan being a £2 million deficit. We were slightly better than the plan position. We've achieved all of the national performance standards in April, so RTT, diagnostic standards, cancer, and ED. We maintain our top 5 position in the country. There are some pressures coming, particularly around the cancer standard, the 62-day standard, and we're going to have a deep dive into that next month at the board. We were also really pleased to note our low infection rates and the continued high compliance and feedback from the friends and family test, which were consistently above 95% of people recommending YDH as a place for their care. The response rate still needs some focus, and we'll be looking at that again and how we improve response rates over the coming months. And also some positive news on our workforce metrics, where we've had a continued reduction in staff turnover, and now we're in a position, I think probably one of a very few trusts in the country, where we have 0 nursing vacancies. It's going to take a while, a few months, for the new recruits to actually be visible on the ward, but all of our nurse vacancies have now been filled. So that was the main board meeting. We also had a seminar session this month where we heard in a bit more detail from the staff working in our subsidiary Symphony Healthcare Services about their plan for transformation over the coming year. Symphony SHS is now running 9 practices with a combined list of just over 60,000, with another 4 or 5 practices in the pipeline to come on board in the coming months. And it provides us with a real opportunity to work in partnerships with primary care to both stabilise primary care, and we noted that the practices within Symphony Healthcare Services have now got a GP vacancy rate of less than 5%, but also to deliver the new models of care in primary care, which are starting to have an impact on demand into YDH. So a really good deep dive into SHS this month. So I'll be back again in a month's time to give you an update on the developments in June.